This is Health Call Online, the place for extended versions of interviews you hear on our weekly radio broadcast, the Health Call Radio Hour, now heard on more stations around the country as they join the Health Call Radio Network. You know, one of the things we like to do on this program is take a look at a different way that people are approaching healthcare. You know, there's no shortage of people who think that America's healthcare system is broken. And so I always like to talk to clinicians who kind of go their own way. And that brings us today to Dr. June Lee. She is board certified in both family medicine and integrative medicine. And she is also trying a different approach of, I'm going to call it really intense functional medicine. So Dr. Lee, thanks for joining us.
Thanks for having me.
Yeah, you bet. Tell me, in your mind, what is functional medicine? How does that work for me as a patient? And how is it different than what I might be accustomed to?
So functional medicine is very different in a way that we approach patients with how and why. So in conventional medicine, where I was trained and was a professor at for the longest time, it's about how to quench down the symptoms, how to address the chronic illness, either surgery or pharmaceutical medicine. But in functional medicine, we really want to know who you are and why you got here. So we really delve deeply into root causes of chronic illnesses.
Ah, okay. I got it. So who's a typical patient? What am I coming to you with?
Our typical patients are people who's actually been through the mill, where they have seen a rheumatologist, oncologist, cardiologist, pulmonologist, and they didn't get their answers as to why they're sick. So they're confused and worried about their health conditions, but they're not getting answers. A lot of them come with a lot of fatigue, just not feeling well, and they've been through so many different doctors, but they didn't get their answers. A lot of them come with depression and anxiety about health. A lot of them come with weight resistance, where they're trying everything under the sun to lose weight, but is not able to get there. Those are probably our biggest. And we do also have a seriously ill patients who have autoimmune diseases and cancer patients coming in.
So a lot of these folks I would categorize them as people who are sick and tired of being sick and tired.
That's a good way to sum it up.
Yeah. So where do you start? Now, you have something called the discovery process. Tell me what that is and how it works.
So our discovery process with our patients really start with actively listening to what they have to say. So we often take a good 60 to 120 minutes listening to them, depending on their problem. We listen to why they got sick, how they got sick, and how they got here. So we delve into their lifestyle, we delve into their relationships, their medications, their journey in the healthcare system pretty deeply, what medications they've taken, who have they seen. We track those records down, and we do a deep dive into analytics by listening. And then we go into analytics by science. That means we check your blood, we check your saliva, we check your stool, we check your urine, any bodily secretion that we can get our hands on. We'll check it to get biochemistry so that we can figure out if there's infection that went without notice, if there's heavy metal toxicity that wasn't checked before, if there's allergies that hasn't, or chemical sensitivities that hasn't checked before. So we go into biochemistry pretty deep with organic acid profile, fatty acid profile, protein. We look into their nutrition pretty deeply as well.
You know, I got to tell you, I've always been somewhat skeptical of this idea of heavy metal toxicity. Tell me more about that and what conditions are linked to it and how it can be treated.
So I have to tell you a story on this one. I had a local anesthesiologist that I was actually familiar with come see me with a lot of skepticism. He was already in his 60s. And he was starting to feel that his memory was lapsing. And he came to see me saying, hey, like, Dr. June, I've known you as a friend here and there, but my memory's really lapsing. I have a genetic predisposition for dementia. I want to be practicing for the next 10, 20 more years. And I don't know if I keep on losing my memory. So we did a full investigation, but we also did a heavy metal toxicity check. And it turns out that his mercury level was 99. That's like the highest I've ever seen in my life. And he told me that he had salmon for lunch for 20 years that he's been eating salmon for lunch. And he enjoys a lot of tuna salads and whatnot. So there was a specific cause for that mercury toxicity. And when we chelated out the mercury, his memory was so much better, his brain fog was so much better. So one of the most skeptical physician came in saying, hey, can you investigate for me? And when we found out there was a mercury toxicity, he was able to get rid of them and go back to his work. So heavy metal toxicity, I think we're exposed to everyone is exposed to heavy metal toxicity these days, whether it's lead or mercury or cadmium or aluminum, whatever it may be, just our lifestyle, our glyphosate from the soil that's been our terrain, and our soil has been so infected with pesticides and herbicides that we're getting them from our water and soil and just everywhere in this air pollutions and whatnot. So when we check it, for the most part, like 8 out of 10 patients have it. And when we remove it out, all of them, almost 100% feel better.
8 out of 10 patients have some form of detox problem?
Right. Just we get exposed to it so much from the environment these days. And those are adults. Pediatric population, definitely, they haven't lived long enough to get all this toxicity in us. Once we're exposed, it doesn't really come out unless you're actively removing it.
So what is that chelation process? That sounds, again, I'm going to put on the skeptic's hat here.
Sure.
That's something that we heard chiropractors talking about, for the past 10 to 15 years.
So chelation process actually is done in the hospital when there is a true toxicity, meaning you're coming in toxic with acute toxic symptoms. So we do it a lot for lead toxicity when children come in with lead toxicity. Way back when the paints were made with lead and children ate paint chips, it became lead toxic. And when they came into the hospital, we did it intravenously with monitoring using calcium EDTA. And that was done inpatiently. Nowadays, we do it outpatiently with calcium EDTA and glutathione, which is an antioxidant that helps you to detoxify. So we boost your body's own detoxification system while we're chelating so that you can keep up with the chelation process and not feel so depleted. Because when you chelate out heavy metals, inevitably, some of your own minerals also come out. So sure, chiropractors do it, naturopathic doctors do it, but more and more your regular MDs are also doing it because they see the benefits of chelating out the heavy metals before it becomes into the toxic level, because then you can do prevention.
What are some of the symptoms that, other than the memory loss you just described, but what are some of the other symptoms that might be associated with this problem?
It really depends on the heavy metal that you have, but lead toxicity often comes in children with poor IQ, hearing difficulties, anemia, because the lead stops the absorption from iron to come in. In older population, we see osteoporosis because lead also stops calcium absorption. So your bones become brittle. And for mercury, because mercury has a higher affinity to fat, a lot of the times mercury ends up becoming neurotoxins. So memory, brain fog, just not being able to think straight. Some of the other heavy metals like aluminum, arsenic, cadmium, including mercury, also is a endocrine disruptor. So your own hormones and neurotransmitters end up not working as efficiently and effectively.
That sounds like that could be associated with 1,000 different complaints and disorders.
Correct.
Yeah. So I can see why you would want to test for that. Is that just a blood test that's going to get me started to understand what my toxicities are?
Correct. So we start off with blood tests, which is a screening test because a lot of heavy metals has a fat affinity. So if you're just checking it in the serum, which is water soluble, you're just getting a screening. So that's like if you get caught driving and drinking, you're blowing in the breathalyzer. It's a random sort of trough that you get. But we also do a challenge test in which we give the calcium EDTA and have the patient excrete out urine for the next 6 hours. And by doing that, you can actually capture the cumulative data from how much heavy metal toxicity is really there in the body.
So this sounds like I am going to be seeing you multiple times with lots of different tests and lots of different appointments. I'm going to have a pretty significant commitment to wanting to get better to go through all this.
Correct. So our process is 14 weeks. We call it the 14-week discovery program. So it's a long process. We do meet with you weekly to sort of analyze all the data points and come up with a plan. We walk you through it. We hold your hand through it. We come up with a plan and we execute weekly. Like any changes in life, you really need 90 days of habit forming period in order for your lifestyle to change. But also that 90 days is what you need for your cell turnover. So our red blood cell, which holds our information of how we ate, what our sugar level is on daily level, accumulates over 90 days. So that data point is checked in the beginning, and it's also checked at 90-day mark to kind of see what your progress is.
Now, I am fairly certain that insurance companies are not going to want to play this game. They're not going to participate in this. What is the cost for the patient?
It's about $7,000. It's $70 to be exact. You do get an hourly appointment every week for the 14 weeks.
Okay. I am in Indiana. You're in Scarsdale, New York. We've got people listening around the country. Can you work with folks no matter where they are?
Of course. So we're doing sort of like video conferencing now, right? I'm in New York. You're in Indiana. So we do have patients all over. We have a lot of Florida snowbirds. We have a lot of people in West Coast in California, but we do have patients in Utah, Seattle, Washington. We have even patients in like Europe, Sweden. We have patients in Dominican Republic. So people do hear about us and they hunt us down through Google. They come see us sometimes initially to meet with us. And then once they kind of trust us, they go into telemedicine, or they've heard of somebody who's seen us and gone through the process and has transformed. If there's a word of mouth sort of connection and trust is already there, then they just book their initial like in a video conference. And we can do a lot of things on telemedicine these days. COVID definitely taught us that we can just do telemedicine. We ship out a lot of the diagnostic, which are in a box because it's bodily fluids that you can collect. And then if you needed blood work, we have home visit nurses come and collect your blood, or we send you to the nearest lab, and then you can go to your Quest LabCorp and draw your blood and then send it back.
Sure. I've done that many times. So I am fascinated with all of this. If, because I'm just a big old health nerd, right? I just can't get enough of this stuff. So what have you learned in treating all the patients you've treated? What are some mistakes I'm making in the way I live that are contributing to these ongoing chronic health conditions that show up, as you cross, like me, into the, I'm mid-60s, and that's when all this stuff sort of starts to come home, right?
Right. If I could sort of sum it up to make it easy for everyone, I would say sugar, sex, and stress. So that's
say that again, please.
It's super easy because it's 3 S's that we all deal with. There isn't a single human being out there that doesn't deal with this. Sugar, sex, and stress.
Okay, walk me through each one of those then.
All right, so sugar is pretty easy. America is definitely a sugar nation. We eat cereal for breakfast and eat pancakes for breakfast, and those are just filled with sugar. Those are desserts, not breakfast. They're not real food. But we eat sugar for breakfast. We often order dessert after dinner. So we're just bombarded with sugar everywhere in this nation. If you go to Asia, if you ever travel to Asia, your breakfast, lunch, and dinner are the same. There's no difference between breakfast, lunch, and dinner. So that's a huge difference.
Yeah, we just have done a couple of episodes taking a look at the role of fructose in possibly contributing to Alzheimer's, and then also just, the obesity switch and how that puts us over the edge. So I'm right there with you on the sugar thing. Okay, stress. Stress is the next one? Stress
is a big one for sure. We're constantly on. I think we work harder than most Europeans, where we just don't turn it off. Our exposure to computer or cell phone and just not turning the devices off and constantly working is pretty high. Not only that, we live in a nation where we pride ourselves for independence, but we live so independently that we're isolated and we're in a nuclear family setting, whereas everywhere else you have a whole community to raise your children with. You have a whole grandparents to look up to and your parents to look up to and rely on for wisdom and childcare and backup. We don't have that here. We live alone in a nuclear family, and our stress level goes up because there's nobody to sort of buffer your stress with. Not only that, we're very much indoors. We're not outdoors enough to see the sunlight, feel the beach and the air and the sand and all that. I tell this to my patients all the time. Rest in Chinese character is wood next to human. So if you're next to nature, you can actually de-stress and shift down and have that downward shift. But if you're constantly indoors, you're driving from one place to another in a car and you're not exercising enough, you're not moving enough, not only obesity epidemics go up, all the other chronic illnesses, including cancer, goes up because you're just living unnaturally and without nature as a component of your life. So stress is a big one because we stress ourselves to the American dream of getting rich or being more successful or whatever it may be. But there's no mechanism in which we have a community to fall back on or the nature that we are supposed to be exposed to, and we're constantly indoors driving from one place to another.
And I'm sure that all of that stress then applies to the hormonal imbalances, the cortisol and adrenal overload and all those things that follow. I think that's where you're going, right?
Right. You're definitely a health nut. To backtrack a little bit, sugar correlates to insulin.
Yep.
That's one of the big components of hormone that drives obesity in this nation. And stress correlates to cortisol, which is our fight-flight hormone that helps us to fight through stuff or flight. But if you keep on fighting, and you're stressed, and you're not downshifting, then you're going to accumulate all your caloric intake in the middle, because primitively, when we were hunters and gatherers, biggest stress was famine or not having enough food. So then you send your body a message of like, store your food because you might be hungry. So then you store it all in your gut. And we certainly see that central obesity in the gut, like everywhere in every city in America, I think.
Yeah. And again, we talked about the importance of understanding visceral fat and how to avoid all those problems, the inflammation and other things that come from visceral fat.
Well,
so I think the third one you said was sex. Obviously, big interest here. Tell me more.
I said sex just to abbreviate the whole thing, but I meant sex hormone.
Okay, I get it.
I also said that to grab your interest.
Okay.
But it's really sex hormones, honestly. Sex hormones decline as we age, right? If you see a baby, you don't know if it's a boy or girl because they don't have sex hormones. If you go visit a nursing home and you see people sitting on the bench from the back, you have no idea if that's a man or a woman because they lost all their sex hormones. And sex hormone is what makes male male and what makes female female, right? So as we lose our sex hormone, we lose our body shape of being a male and body shape of being a female. So being a female, you want that curvature of like small waist, bigger hip, but that hip to waist ratio is super important in your cardiovascular risk assessment, as well as like obesity, central obesity, visceral fat we just talked about. But also men, when they have a lot of testosterone, their shoulders are broader, they hold themselves in a different like sort of even posture because of testosterone. But those are lubricants in our body that makes us not Tin Men from Wizard of Oz, right? It pertains to our brain function, our motivation, our depression, our anxiety. How we make our decisions are all sort of driven from that sort of primitive sex hormones. And so when you lose that, you lose a little bit of motivation. You don't want to move as much. You don't want to work as hard, all of that. And then that contributes to sedentary lifestyle. And that contributes to obesity and metabolic cancers to come.
Yeah, that vicious spiral then begins. I get it. If I were to see you either remotely or in person, tell me what that first experience is going to be like. You said we're going to talk for an hour or so, and I want to know, what are you really probing for? What are those key factors that are just going to set off a red flag for you?
Right. So I definitely look at who you are. Our practice is called See Beyond Medicine because I really want to see you clearly and see you for who you are. So I would definitely ask, what do you do for a living, but also who do you live with and how do you conduct your life. So I do something called 24-hour recall. I'd be like, Lee, what time do you wake up? What time do you poop? What does your poop look like? What do you eat for breakfast? What do you eat for lunch? What do you eat for dinner? What do you drink? How much alcohol do you consume? But I do that in pretty in-depth because without tweaking your life, I'm not changing anything. Because if you live the way you live, your chronic illness is just not going to change, whatever that is, right? Our habits are who we are. And what we do and how we make our choices on a daily level becomes who we are. So I definitely go through your daily life. I also go through pretty in-depth genetics because there is genetic propensities and vulnerability that is almost like a hard wiring that makes us who we are. We think we're making our own choices, but you know what? My mom and dad already made my choices for me. Whether that is genetically or environmentally by role modeling a certain lifestyle. So to break away from that, it takes an immense amount of insight. Oh, my mom and dad did that wrong, so I'm going to do it differently. Or somebody actually shining that back to you and mirroring and reframing lifestyle. So I do a lot of that in which I kind of take all the information in and I analyze it and I reframe it so that you can see beyond your upbringings, where you come from, how you're living at this time, your age, your current illness, whether it's cancer or obesity or just the simple aging process. Because people think obesity is not a disease. It is a disease. People think aging is physiological and normal, but it is a disease. Because if it's not a disease process, then a same 60-year-old, like your classmates, should all look like you, young and vibrant and healthy and fit, right? But if you go to your high school reunion, college reunion, everybody looks different. Some look like they're 80 years old and some look like they're in their 40s. That's because you've aged in a different way, whether that's genetic vulnerability or what you did in your lifestyle. Some people just age faster than others. That's why it's a disease process. So I kind of emphasize all of that and focus on prevention. And by preventing or by sort of like unwinding the lifestyle and kind of giving them a different programming, then they can start changing their differences. It takes a good 90 days, first off, and then we have to maintain it longer than that. So we do what we call concierge medicine, where people just sign up for the membership and there are patient forever. We're very committed and we're very tenacious in helping you through so that you can see through the whole process.
Yeah, so you're really a health coach.
We do that. We have MDs and PAs and nurse practitioners who function as a provider, who oversees the whole plan. And we have health coaches and RNs who are your accountability partners who holds your hand and walks you through the plan. They're like your tutors, making sure that you do your homework.
I am fascinated by the anti-aging movement. I've been following Dr. David Sinclair and all his work and the information theory of aging. Are you addressing any of those factors, and what's your thinking about all of that?
Yeah, so I definitely have a board certification in obesity medicine and as well as anti-aging. So healthy aging really involves your lifespan equaling your health span. So it's completely meaningless if you live to 99 and you stroke out at 65.
Right.
So that your 30 years of life is just meaningless. So you definitely want your health span to match your lifespan. We do testing for sure. We check your telomere to predict how long you're going to live because you want to know how hard you want to work. So we check the telomere, the end caps of DNA that kind of dictates how long you're going to live. And with that information, we do a lot of not just lifestyle, but serious IVs like NAD. David Sinclair definitely talks about NAD, resveratrol, and some of the stuff that he does to kind of make the health span equal your lifespan. So we do all of that, whether it be nutritional plans, supplements, or IV therapy. We make sure that you live a full, healthy, longevity driven life.
I'm so interested in following your successes. I'd love to hear more from some of your patients at some point down the road. Wrap us up with a thought for people. If what's the single largest thing I can do to change the quality of my life?
Single is really hard. If you really make me choose single, then I'm going to choose eliminate sugar. Just eliminate all sugar out of your life, whether that be processed or simple carbohydrates. So complex carbohydrates are fine because it has a lot of fiber in it. But other than that, your simple bread, pasta, all has to go. And forget desserts and candy bars and cereals and pancakes. That's completely gone. But if you could do a lot more ketotic, like high fat, high protein diet, you could probably increase your muscle mass and like work towards your longevity without obesity and cancer. It's probably the single most important thing that's easily executable. Or not so easily executable.
Yeah, not in America anyway. Yeah, it's tough. It's tough. So a keto diet is what you basically just told me.
Yeah, no, I definitely am a keto proponent. I love keto diet. I actually love green keto. That's something I'm pretty passionate about. So when people get on a keto diet, a lot of the times they think it's a protein-based diet and they increase your animal protein. That's not what I want. I actually want more of a green keto diet in which you eat like a lot of plant, a lot of vegetables, and high fat driven from plant. That's olive oil, avocado, nuts and seeds, and some fish also. And then you do have some animal products that are clean, organic, grass-fed, but you do still want to try to avoid too much animal protein and dairy-based protein. So it's a lot of vegetables with a lot of fat and some protein, but it isn't like jack up your beef and steak. So I kind of frame it in a way. Tom Brady does a good job doing green keto.
Yeah. Okay. Yeah. I do.
So he's like, I think, 50% like vegan with 20 days of like eating animal protein. 50% vegan was 20% of like eating animal protein. But green keto is great because it reduces your risk of diabetes as well as it reduces your risk of cancer.
We have skipped around a lot, but before I let you go, just one last thing here. Once you're thinking on either calorie restriction or timed eating, intermittent fasting.
So I'm not a big fan of caloric restriction because that's such a temporary result that's going to bounce right back when you reduce your calorie. I think I focus more on when you eat, how you eat, who you eat with, do you chew, all of that actually matters because if you're just swallowing food, then you're not really absorbing all the macronutrients and micronutrients that you need to actually digest and absorb food. But intermittent fasting, I think, has a place because it stimulates your stem cell. It does help you with longevity. And if you're somebody who just loves food, just by restricting the hours in which you're eating, you're giving your gut a little bit of free time to restore and rebuild. I can talk about everything in so many different facets, but intermittent fasting definitely helps to restrict some calories in that way, but just restricting the calorie to 1,000, 500, or whatever that may be, I think has its limitations and dangers in promoting eating disorders and whatnot. But if you can eat healthily within a timed amount of time, I think that's a great thing to have like bowel rest and stimulate your stem cells.
Well, we're going to leave it there. I would look forward to talking with you again. That is Dr. June Lee. She's the medical director of CBeyond Medicine, and I'll put links in the show notes for everybody so they can find you online. Dr. June, thank you.
Thank you so much for having me.